Hello, everyone, and welcome to Incorruptible Massachusetts. This is where we hope to help you understand state politics. So we talk a lot about why it's so broken, what we can have here in Massachusetts if we fixed it, how you can get involved. Today, we are talking about reproductive rights, abortion rights, and Roe versus Wade, what's happening there. And we have an amazing guest. I'm going to let our goofy regulars introduce themselves, including myself. Starting with Jordan Berg Powers.
Jordan Berg Powers. I work in politics in Massachusetts, and I use he, him.
And Jonathan Cohn.
Jonathan Cohn, he, him, his, activist in Boston for progressive issue and electoral work here in Massachusetts.
Anna Callahan, she, her, coming at you from Medford, vying for the goofiest, but we'll see. And we have an amazing guest today. We have Dr. Jennifer Childs-Roshak, who's an MD, and she's also the CEO and president of Planned Parenthood League of Massachusetts and the Planned Parenthood Advocacy Fund of Massachusetts, doing incredible work in this area. Thank you so much for being here.
Thanks so much for having me. And my pronouns are she, hers, and I really appreciate the fact that that you guys normally have a much more local Massachusetts-based conversation, and this one really kind of hits the notes on what's happening out there beyond our borders a bit. So thank you for the opportunity to talk about abortion care.
Oh man, we are I would say excited about it. We're excited about the conversation, but like super depressing what's happening at the national level. Can you talk to us a little bit about what is happening right now with Roe versus Wade?
Yeah, absolutely. And I think I just want to underscore, I'm a family doctor. I'm not a lawyer. So, I think, future conversations, you can dive a little bit more into the actual nitty gritty. But what's happening right now in our country is what we're expecting that the Supreme Court has decided to take up a case called Dobbs versus Jackson Women's Health Organization. And that case is asking the Supreme Court to opine on a 15-week ban. So the current decision with Roe v. Wade is abortion care is legal up to viability, and 15 weeks is well before viability, so earlier. And so the other piece of that case is they're asking the Supreme Court essentially to overturn Roe v. Wade. And what we expect that would do would be open up a floodgate of multiple states. Up to 26 states have already teed up trigger laws, they're called. So as soon as Roe v. Wade is overturned by the Supreme Court, then 26 states, so that's more than half, right, of the United States would overturn access to abortion care in the country. And the other quick thing I just want to point out is that 2021 has been the busiest year for abortion foes around the country. Over 100 changes and restrictions to abortion care have been in place. SB 8 or Senate Bill 8 in Texas is a great example of what's happening all around the country. But over 100 just in 2021 alone.
A horrible example, yes. A great but horrible example of what is happening around the country. So interested in the discussion, I neglected to ask you just about the organization that you work with, and can you give us a little bit about kind of your mission and what how you're involved in this fight?
Yeah, absolutely. So Planned Parenthood League of Massachusetts is one of 48 affiliates around the country providing comprehensive sexual and reproductive health care. In Massachusetts, we have 4 health centers around the state. We provide abortion care, birth control, person exams. We do gender affirming hormone therapy at our health centers. We do HIV pre-exposure care as well as post-exposure to reduce the risk of HIV and sexually transmitted infection testing and treatment. So pretty broadly, sexual and reproductive health care. We are statewide, so we take care of patients from all parts of the state. We also, with the pandemic, like a lot of organizations, spun up a very robust telehealth platform. And so our patients, except for the things that actually absolutely have to be seen in person, we are able to take care of patients using technology. And right now, about 25% of our visits overall are being conducted with telehealth, which I think bodes. It's great for patients. Patients love it. Patients have been asking me for 15 years, like why they couldn't get a visit with me over telehealth. So I think, it's great for patients, and I think it's also a great thing to think about for the future of abortion access, even potentially across state lines.
Yeah. So in your position, like what's so great about Planned Parenthood is you're on the ground, like with people who have these needs like every single day. And so can you talk to us just a little about what does it mean for Roe v. Wade to be overturned? I mean, obviously we'll ask about Massachusetts in a second, but I just mean, what does it mean for people's lives who are in these situations? How is this going to affect people?
Yeah, I mean, it's heartbreaking. When you think back, I'm old enough to have been alive during the 1973 during Roe v. Wade, and I have colleagues and patients who lived through that time when women were dying needlessly because they were so desperate to get care. And to be very clear, abortion care is very safe, probably safer than a colonoscopy. It's certainly much safer than having a baby, 14 times safer than actually taking a pregnancy to term. And that's not a reason to have an abortion, but it certainly should be options for people. And so, what we know is without access to safe and legal abortion, and if Roe v. Wade were overturned, about half of the people who can get pregnant in America will not have access to abortion care. And, part of the challenge with abortion care is that it is routine health care. Like I said, it's very safe. It's something 1 in 4 people who can get pregnant have had an abortion. So it's common and it is safe. And it's also, but it's one of those things that has been heavily stigmatized. And so I think, one of the things that we see with patients is when they don't have access to information, they don't know what their options and choices are. When they are, kind of steered in one way or another, they don't have an askable adult. If they're a young person, it really impacts people's health and well-being. And we know that folks who would like to have an abortion, who are not able to access an abortion or denied abortion care, they are 4 times higher to end up below the federal poverty level. So there's lots of reasons why people have abortions, and I think one of the things that does get in the way is people assuming it's only one air quotes type of person who has abortion care, but there's lots of reasons why. And the bottom line here is that the person who's pregnant and their partner and their doctor should be making those decisions. Politicians should never be deciding who gets care and where, and that's what we're seeing around the country.
I just want to underscore one point that you made about safe and legal, because it really underscores that point about how it's like abortion didn't suddenly become a reality, right? With Roe v. Wade, what's happened since is be able to provide, making it so that it can be safe, it can be legal, and be part of kind of the general framework that we understand as healthcare. So that like whenever conservatives are trying to quote unquote say like when they're trying to ban abortion, like the issue is that like a practice that has happened will still happen, but it will be riskier for people who don't have access. It can be kind of unsafe, and it'll basically be putting their lives at risk for in the ways that existed kind of pre-Roe v. Wade, where exactly. Women are often in kind of unsafe situations trying to do something that they should be able to do as part of the regular healthcare system.
Absolutely, and thank you so much for highlighting that, because we actually saw and we're seeing it now in Texas again, but previously in Texas there was another case which effectively banned abortion access. So something can be legal, but if someone doesn't have access to that because of geographic differences or financial difference, there's lots of reasons why someone can't access something that they have a right to. And what we saw in Texas the first time around a few years ago was we did see an increase in not just people trying, traveling, but, people Googling, how do I do my own abortion? People showing up in emergency rooms with complications, people traveling to Mexico and other places. So, we know that what's going to happen. And it's exactly what we saw pre-Roe v. Wade. It's why Roe v. Wade was put in place in the first time. And we know for sure that being denied access to abortion care doesn't mean that people just say, oh, well, forget it then. I'm just not going to do that. They proceed with unsafe and unhealthy ways to achieve their goal. And, and I think the other thing that you said was really important. Not only does this affect the person who's pregnant's life, it affects all the people around them. For those people who die, and we saw this again. I'm not trying to be inflammatory. We know that this happened before Roe v. Wade, and it will happen again. That impacts the children that are left behind. The families that are left behind. The majority of people who seek abortion care have other live children, so they know what decision they're making, and it really it's a ripple effect across communities.
So we've talked a little bit about kind of broadly the effect, but when Roe v. Wade is overturned by the Supreme Court, what would that mean here in Massachusetts?
Yeah, so I mean that's something I am grateful for, and there's been a lot of work in Massachusetts over the last 10 years in particular to build a pro-reproductive rights legislature to make sure that archaic laws, like laws that were still on the books that married women, needed permission from their husband to buy birth control, like things like that have been repealed. We've spent a lot of time making sure that birth control is accessible. We have really worked hard to try to get sex education passed. And this is all, this is all in coalition work, right? This is not something that Planned Parenthood has done. We have not done this by ourselves. It certainly takes a village. But that I think the idea that, and this was several years ago, that the right to access abortion care is a constitutional right in the Massachusetts Constitution is really important to note. I think the other thing that's really important to note is that Massachusetts has for a very long time been a leader in understanding that healthcare is a right, and healthcare is critical, and a healthier population makes for a healthier state. And so for a very long time, making sure that people who are on Mass Health or the Medicaid equivalent in Massachusetts have the same access to the same healthcare services as including abortion care that other folks on other insurance have. So those are things that have been in place for quite a while in Massachusetts and will remain in place no matter what happens with Roe v. Wade.
Yeah.
One thing I'd be curious in terms of follow-up for that is, what are things that, let's say, that under the condition that Roe v. Wade were to be overturned by the Supreme Court, how can Massachusetts kind of like as a state be helpful to, let's say, the other states in the country, kind of, let's say, like to individuals in those states, not the states cross states. Let's say in Texas, or kind of we were talking about before, those kind of other states. Like, is there kind of an outward facing role that's like something where a place like Massachusetts can do, given how so many of us often think of Massachusetts in that framework as well of its role in kind of the country as a whole?
Yeah, absolutely. And I'll continue to focus on the patient care aspects.
Yeah.
Because there's, I think there's a lot that can be done advocacy wise, but I think for us and for, Planned Parenthood around the country, and for independent abortion providers as well, I think, the things that we can do are supporting patients financially. So every state, typically has some sort of, we call them justice funds, but, the ability for patients, number one, phone call, a phone that people could call into, a phone line to get information, get steered towards, and so it's sort of a patient navigation effort, but get steered towards the services that are best for them and closest for them. And then connect people with the background support to get to an appointment. So they might need childcare. They might need finances for a bus ticket. They might need someone to go with them, so I think, those types of things that we can support patients no matter where we are. I think the other thing that is really important is figuring out how to continue to leverage technology. So, there are a couple of two different ways you can have an abortion. One is, actually there are three ways. One is a natural abortion that happens a lot. A third of pregnancies actually do end up in spontaneous miscarriage and spontaneous abortion. A medication abortion can occur up to about 10 weeks. And that is something that we are providing via telehealth for a lot of patients now. If they sort of fit the right medical criteria, but and that's something that technology has really made a difference in the ability to mail people medication, the ability to have an informational visit with a provider over Zoom goes a long way. And then the third way, the way that people mostly think about abortion care is a surgical abortion, which does need to be done in person. So I think, talking with patients about what their options are, what their, not just for care, but also, for what support systems they need to seek the care that they're choosing. I think all of those things, a lot can be done leveraging technology. I think the last thing I would just say is I think there are some roadmaps that various states like Massachusetts, we've been able to create a little bit of a advocacy roadmap, a clinical training roadmap. We do a lot of research at PPLM, Planned Parenthood League of Mass, both social science and clinical research that then guides both the advocacy work and programmatic development, but also the clinical work that and the experience that patients have. So I think those are all things that states like Massachusetts are doing and can continue to do for patients no matter where they live.
And is there a piece that we could pass legislation to make it easier to do these things across state lines? Is there a legislative, sort of role to make the practice, the sort of, you're focusing on actual care for folks, right? But there's legislation that guides this. What could we be doing, to be advocating for better legislation around it?
Yeah, so I think there's a bunch of different things. So the telehealth laws, I think are really important, and regulations and payment for telehealth. And I think, some of those are working their way through the Massachusetts legislature. What we saw was that the pandemic exemptions really made a huge difference for patients, and not just patients coming for abortion or sexual and reproductive rights care, but patients who have diabetes, patients who have heart disease, right? Depression, so many reasons why telehealth. So that's one. There's a number of bills that we are supporting in the legislature that expand abortion access. So things like making sure that health centers in colleges and universities can provide abortion care. I think it's also really important to start thinking about, it's not just about abortion care, and it's not just about healthcare. It's about health and wellness in general. And that includes, access to healthy food and access to safe neighborhoods and the ability to vote for people who are going to then support those things. So I think those are all things. And without getting too wonky, one of the things that's always a challenge for just physicians, and I'm sure the same is true for nurses, but my knowledge is mostly around physician credentialing, is getting a provider up and running in a practice is really time consuming, and it delays the time for someone to actually start seeing patients. So it impacts patient access to getting into the healthcare system. And whenever someone tries to move their medical license or nursing license across state lines, you start the whole process all over again. So in my little pipe dream of a perfect world, I would include something that crosses over state lines that allows a doctor or a nurse practitioner or midwife or a physician assistant to have a universal credentialing system where everyone gives them the thumbs up, and then they can practice in various states. And that would make a huge difference for states that are really geographically spread out, where it's really hard to recruit providers to an area. I think, it would be huge to just health in general. So, if you're asking me about a little, fantasy world, it would include that as well.
And one of the things that's near and dear to my heart, because I get frustrated that not only do people wrongly attack sort of access to healthcare and women's healthcare, but then, especially around abortion, but then they also are like, you can't learn about your parts. You can't learn about the things. You can't do anything to prevent, do the just sensical things to prevent people from having from having unwanted pregnancies. And I'll just say really quickly that, I grew up at a time in the 90s where we had comprehensive sex education. And we saw that in my generation, people who had those years, abortions went down, sexual partners went down, like the things that they claim won't happen actually happened. Right. And the opposite is true. When you don't know what you're doing, you make all sorts of bad decisions. But when you have information, you're making safer decisions. So contraception use is higher among people my age. Abortions went down among people my age. Right. We literally saw the things that we know will happened. And they were like, nope, those don't happen. In fact, head in sand. It reminds me, it's like a precursor to anti-vaxxing, the sort of anti-sex ed stuff. It's like, it doesn't matter that the facts are that abortions were down and people were safer and actually all the things they say don't happen. We're just going to pretend that didn't happen. Like we're just and pretend a thing. So you talk a little bit about the fight for sex ed. And for those who don't know, in Massachusetts, if you teach sex ed, you can literally teach anything. It doesn't have to be grounded in fact.
And that bill has been stuck there at the State House for a long time. The bill that would fix it.
Exactly. I think it was first introduced by Catherine Clark, and we know where she is now. So and thank you, Jordan, so much for bringing that up, because I think it's so easy, and I find myself doing this as well, talking about Roe v. Wade and abortion access. But the story starts sooner, right? The story starts, way sooner with sex education and understanding, your body, understanding consent. Understanding how to what options there are for birth control. And you are absolutely right. And it's something that, that we do talk about a lot, there is a reason why unplanned pregnancies are down. There's a reason why the abortion rate is dropping, and it has been dropping. We are all doing a much better job with sex education and birth control. And even that is a little bit on the, I think certainly on the chopping block when Biden's predecessor was in office. It was clear that there was no priority setting around preventive care. And, one of my favorite lines is, if you're anti-abortion, then you should be all in on birth control and sex education. And so, maybe a silver lining, it's probably a little fantasy world, but, would be that people in these red states that are super anti-abortion, maybe they'll be really, really positive about birth control and sex education. Honestly, I don't think that's going to happen, because it's really about politics and it's not about healthcare. And it's about controlling people. It's not about giving them personal agency. And so, I wish that were going to be the case, but hope isn't a strategy, as we know. But I think, thank you for lifting that up, because that is absolutely right. And plenty of ways to go and do better, even in Massachusetts, around sex education, as you mentioned, and also around birth control access.
Yeah, so we're talking about this before we started, and we're very excited to dig deeper into the politics, the national and state politics around abortion access and reproductive rights. And we are going to have another conversation about that for sure. But Jen, thank you so much. This is really, the incredible work that you do is so important. And we love having you here. So we're looking forward to having you back.
Well, thank you so much. And I always love being able to talk about patient care. And I want to just end not only by thanking all of you for lifting this issue up. I'm looking forward to the political side with my colleagues in the coalition. But I do want to just do a quick shout out to all of the clinicians, the healthcare providers on the front lines, whether you're providing abortion care, sexual and reproductive health care, primary care, emergency care, ICU care, it's a really tough time. We so appreciate all the work that you're doing, and this is about this particular fight, but it's real, and really want just a shout out to all of the healthcare providers. Thank you.
Absolutely. Thanks so much, everyone. We'll see everybody next week.
Thanks so much. Take care.